So today let me start with the anatomy of the hip bone. So first, at the end of this lecture, students should be able to define the hip bone, know the parts of the hip bone, the muscles that are attached at the hip bone, and the muscles that originate from the hip bones, and ossifications and clinicals of the hip bones. So those things that can affect the hip bones. So the first thing we are going to start with is the definition of the hip bone. So what is hip bone? So the hip bone is a large irregular bone forming the lateral part of the pelvis. So we have the pelvic girdle. So we have the pelvis and we have the pelvic girdle. So the pelvic girdle, just what they do is to supply the weight of the upper limbs towards the lower limbs, and these are bone which are banded anteriorly by the pubic symphysis, posteriorly by the sacrum, and laterally by the hip bones. And these hip bones is what we are trying to discuss. So we're going to start with the hip bones. So the first thing you have to know about the hip bones is the definition. So what is the definition of the hip bone? So the hip bone is a large, it is an irregular and forming the lateral part of the pelvis. So the hip bone is first, it is the large, it is an irregular bone, and it forms the lateral part of the pelvis. So the next thing we are going to talk about is the parts of the hip bone. So before I start talking about the parts of the hip bone, so just take a look at the hip bones. So we have the ilium, we have the ischium, and we have the pubis. So these are the parts of the hip bone. So let's start with the parts of the hip bone. So what is the first thing you have to know about the hip bone? Is the ilium. So we have the ilium and we have the ischium, and we also have one beautiful bone in the hip bone, which is the pubis. So the first part of the hip bone is the ilium, and take a look at the ilium. The second part of the hip bone is the ischium, and this is the ischium. And the third part of the hip bone is the pubis, and this is the pubis. So let's take them individually. So you have to look at something here. So this is called the acetabulum. So what is so special about the acetabulum is this is where the three hip bones fuse together. So the ilium, the ischium, and the pubis, they fuse together to form what we call the acetabulum. And this acetabulum is where the head of the femur inserts. So this is the acetabulum. So let's start with the ilium. So we have the ilium. So what is the ilium? So the first thing you have to know is the ilium is the uppermost largest part of the pelvic bone. So we have the hip bone, and in this hip bone they are made up of three parts. So the first thing or the first point you have to know about the ilium, it is the uppermost and it is the largest part of the hip bone. So the second thing you have to know about the hip bone is it has a crest, and this crest is called the iliac crest, and this is the iliac crest. Now take a look at the iliac crest. So the one important thing you have to know is the iliac crest. So the third thing you have to know is we have spines of the ilium, and these spines of the ilium, we have about 4 spines of the ilium. So you have about 4 spines of the ilium, and this first spine you have is the anterior superior iliac spine. The second spine you have is the posterior superior iliac spine. The third spine you have is the anterior inferior iliac spine. Anterior inferior iliac spine, and the fourth spine you have is the posterior inferior iliac spine. So look at the spines. So this is the anterior superior iliac spine, this is the posterior superior iliac spine, this is the anterior inferior iliac spine, and this is the posterior inferior iliac spine. So take note of those things. So another important thing you have to know is In the hip bone, we have what we call the sacroiliac joints. So we have the sacrum and we have the sacroiliac joints. So what is so special about this sacroiliac joint is the sacrum fuses with the ilium to form the sacroiliac joints, which forms the posterior boundary of the pelvic girdle. So the ilium and the sacrum fuses together. The ilium and the sacrum fuses together to form the sacroiliac joints. And this is the sacroiliac joints. And this is our ilium. So this is the iliac fossa. And this is where the muscle attach. So the muscle that attach at the iliac fossa is called the iliacus muscle. Now we have the iliac tuberosity. We have the iliac tuberosity. So in the iliac tuberosity, there is a ligament that attach at the iliac tuberosity. So this is the iliac tuberosity. So the muscles the ligaments that attach at the iliac tuberosity is called the sacroiliac ligaments. So the sacroiliac ligaments attach at the iliac tuberosity. So we have the gluteal surfaces. We have 3 gluteal line at the gluteal surface. So we have the posterior gluteal line, we have the anterior gluteal line, and we have the inferior gluteal line. So in the gluteal surface, we have the anterior gluteal line, we have the posterior gluteal line, and we have the inferior gluteal line. So this is the posterior gluteal line, this is the anterior, and this is the inferior gluteal line. So let's talk about the ischium. And what are the important things you have to know about the ischium? Is the ischium is the posterior inferior part of the hip bone. So the ischium is the posterior inferior parts of the hip bone. So that should be your number 1 point. And in this ischium, we have a spine, and this spine is called the ischial spine. Now look at the spine. This is called the ischial spine, and below this spine is the lesser sciatic notch. So below the ischial spine is the lesser sciatic notch. So this is the lesser sciatic notch. So what is so special about this lesser sciatic notch is the sciatic nerve passes through the greater and the lesser sciatic notch. And we also have the ischial tuberosity. So we also have the ischial tuberosity. So the main function of the ischial tuberosity is it is the sitting position or the sitting bone. So that place, the bone you sit on when you are sitting down, is the ischial tuberosity. And when you combine the ramus and the pubis, you now form what we call the obturator foramen. So the obturator foramen is formed when the ramus and the pubis combine together, and this is the obturator foramen. And this obturator foramen is covered by a membrane called the obturator membrane. So this is the obturator foramen, and it is covered by a membrane known as the obturator membrane. We have the pubis. So we have talked about the ilium, the ischium. Now we are in the pubis, and these are the 3 parts of the hip bone. So the most important thing you have to know about the pubis, it's what? It is the anterior most of the hip bone. Remember, the ilium is the uppermost and the largest part of the pelvic bone or the hip bone. Ischium is the most posterior inferior part of the hip bone, while pubis is the most anterior part of the hip bone. So the main point you have to, or the main thing you have to know about the pubis is it is the most anterior part of the hip bone, and this pubis form what we call the pubis symphysis. So we have the pubic symphysis, and this pubic symphysis is what bound the pelvic girdle anteriorly, and this is the pubic symphysis. Now take a look at the pubic symphysis. This, what you're seeing here is the pubic symphysis, and this region is the pubis. There is presence of pubic tubercle in the pubic body where the inguinal ligaments attach. So another point you have to know is the inguinal ligaments attach at the pubic tubercle, but these inguinal ligaments originate from the anterior superior iliac spine. Now look at the anterior superior iliac spine, and this is the pubic tubercle. Now this ligaments you are seeing here is the inguinal ligaments, and the inguinal ligaments originates from the what? From the anterior superior iliac spine and insert at the pubic tubercle. Let's discuss about those muscles that are found in the ilium. So the first muscle you have to know is the gluteus maximus. So the first muscle that should be in your mind is the gluteus maximus. So where does it originate from? So we have two sets of muscles. So we have muscles that originate from the hip bones, and we have muscles that attach from the hip bones. So we are going to start with muscles that originate from the hip bones. So the first muscles that originate from the hip bone, there are so many other muscles, but I'm going to list as many as I can. So the first muscle you have to know is the gluteus maximus, and the gluteus maximus originates from the posterior surface of the hip bone. It originates from the what? From the posterior surface of the ilium. And the second muscle you have to know is the gluteus minimus. So the gluteus minimus originates from the gluteus surface between the anterior and the inferior gluteal line. So remember, we have the anterior and we have the inferior gluteal line. So but remember, we have the posterior. So after the posterior we have the anterior, and after the anterior we now have the inferior. So between the anterior and the inferior gluteal line, that is where you're going to see the gluteus minimus. So another muscle is the gluteus medius, which originates at the gluteal surface between the anterior and the posterior gluteal line. So we have the tensor fasciae lata, and the tensor fasciae lata originates from the anterior superior iliac spine to and the iliac crest. So this is the iliac crest, and this is the anterior superior iliac spine. Now look at the tensor fasciae lata. Let me zoom in. This is the tensor fasciae lata. It originates from the iliac crest, and this is the iliac crest, and the anterior superior iliac spine, and this is the anterior superior iliac spine. So that is what you should keep in your mind. So another muscle we also have is the sartorius muscle. So where does the sartorius originate from? The sartorius is the longest bone in the thigh, and it originates from the anterior superior iliac spine. So this is the sartorius, and this is the anterior superior iliac spine. And another muscle you have to put in mind is the iliacus, which I've mentioned before. It originates from the iliac fossa, and we have the obturator internus. So when you hear the word obturator internus, we have the obturator membrane and we have the obturator foramen. So this obturator foramen is surrounded or covered by the obturator membrane. So therefore, any muscles called obturator internus or obturator externus all originates from the what? From the obturator membrane. So we have so many other type of muscles that attach there. So we have the ligaments of the hip bone. So what is the first ligament you have to know of the hip bone? So we have the inguinal ligaments. So where does the inguinal ligament originate from? The inguinal ligament originates from the anterior superior ciliary spine. And where does it insert? It inserts at the pubic tubercle. So another ligament you have to know is the sacrotuberous ligament. So this sacrotuberous ligament, where does it originate from? From the word sacro. You should have known that it originates from the sacrum and the coxae. So it originates from the sacrum and the coxae, and it inserts at the ischia tuberosity. So it inserts at the ischia tuberosity. So the inguinal ligament originates from the anterior superior ciliary spine and it inserts at the pubic tubercle, while the sacrotuberous ligament originates from the sacrum and the coxae and it inserts at the ischia tuberosity, while the sacrospinous ligament, from the name sacro, what should be in your mind is what? The sacrum. And spinous, it is a spine. Which spine? The ischial spine. So the sacrospinous ligaments, the sacrospinous ligaments, so it originates from the sacrum and it inserts at a spine called the ischial spine. So let's talk about the ossification of the hip bone. So what should you know about the ossification of the hip bone? So the first thing that should come into your mind in the ossification of the hip bone is the hip bone has three primary centers. So what are primary centers? We have secondary centers and we have primary centers. So primary centers, so where the main bone formation is occurring. So we have the three primary centers, and these three primary centers belongs to each of them. Remember we have three bones in the hip bones, which are the ilium, the ischium, and the pubis. So each primary center belongs to each bones found in the hip bone, which are the ilium, the ischium, and the pubis. So in ossification, we have two types of ossification that occurs in the hip bone. We have the ossification that occurs before birth and we have the ossification that occurs after birth. So what are the ossifications that occurs before birth? So before birth, the first thing that happens is the ilium ossifies at 8th week. So the ilium ossifies in 8th week of the intrauterine life cycle, which is before birth. The ilium ossifies. The ossification also means conversion of cartilage to bone, or when connective tissue is completely replaced. When connective tissue, embryonic connective tissue, is converted to bone, or when cartilage is completely replaced by bone, that is also called ossification. So just put that at the back of your mind. So we have two things that occurs in ossification of the hip bone, which is ossification before birth and ossification after birth. So the ossification that occurs before birth is the ilium is converted into bone in the 8th week, and the second thing is the ischium is undergo ossification in 4th month, and the final thing that happens before birth is the pubis undergoes ossification in 4th to 5th month. So before birth, the ilium undergoes ossification in 8th week, the ischium undergoes ossification in 4th month, and the pubis undergo ossification between 4th and the 5th month. So after birth, what happens? So after birth, there is another type of ossification that happens, but here the ossification is very, very important. So after birth is when the three hip bones fuses together completely. So at age 18, this is where the three bones fuse together and form what we call the acetabulum. So the acetabulum is formed at age 18, and it is ossification that happens in the hip bone after birth. thing you have to know is the inferior ramus of the pubis and the ramus of the ischium fused at age 7th year. So the ramus or the inferior ramus, remember ramus is just a branch, is a, just neglect the name. The word ramus means branch. So the pubis has a branch, and that branch is called the inferior ramus of the pubis. And the ischium has a branch, and that branch is called what? The ischium ramus, or ramus of the ischium, which fuse together at what? At the 7th year. So let's talk about one final important thing you have to know is the clinical application of the hip bone. So what are the clinical applications of the hip bone? So first is the fracture of the neck of femur. So the fracture of the neck of femur. So fracture of the neck of femur damages the blood supply supplying the head of the femur, causing avascular necrosis. Now you have to know something. The blood supply supplying the femur enters through the head of the femur, and when this neck is damaged, it affects the blood supply. And the easiest, most commonest place where fracture can occur in the femur is the neck of the femur. So fracture of the neck of the femur can affect the joints, and remember, the joints is formed by the head of the femur and the hip bone. So when the neck of the femur is affected, the joints is also what? Affected. So we have the acetabular fracture. So another thing you have to know is what? The acetabular fracture. And what happens in this acetabular fracture? A strong injury affecting the hip joints, which affect the acetabulum occurs. So from the name acetabular fracture, what should come into your mind is the acetabulum, what has been damaged. And when it is damaged, it affects the hip joints. So this is the end of our lecture. So I hope you enjoyed this video. Don't forget to like, subscribe, and hit the notification bell for more videos like this on Sagacious Netherlands. Goodbye, see you next time.